Today, we have with us Reenita Das, who will shed light on what is in store for 2021. Reenita is a partner and senior vice president for transformational health at Frost and Sullivan, who was also recently voted in the top 100 women in femtech and health tech. Thank you for joining us, Reenita.
Okay, so I think healthcare has changed as a
Sorry.
result of COVID-19. I think one of the big things that have happened is that we are starting to look, the biggest trend that I see that we're going to look at in 2021 will be that the patient is no longer the consumer. And I believe there is tremendous growth opportunity in the healthcare system as we extend from pre-diagnosis to post-treatment. So what we will see happen is that the healthcare system was very much based on a venue-based system. And in 2021 onwards, the venue is not going to become important anymore. We're going to move from a brick and mortar venue to a virtual venue. And what will become important is really the patient engagement and the patient experience. So in our views, we are looking at almost 45% of all interactions that consumers will make across the world to be digital. And therefore, companies and organizations and healthcare systems need to start setting up the digital front door, which is going to create a lot of opportunities in the ecosystem, both by way of consolidation as well as by way of incremental revenues for companies that have not seen that. I also see that we will see consistent focus on the patient as the North Star while building software solutions. The next big trend that I see taking place in this economy is the whole aspect of platforms. Platform is going to become the next normal, and we will have to start building a lot of tools, software, hardware, apps that will help to build the platform. So one of the things that medical device companies need to be thinking about is how to widen the solution plus strategy to better support healthcare providers. And therefore, they will have to start thinking about adding value in their offerings, whether they acquire those offerings or whether they make it themselves. So this is another big trend that we see happening. Some other big trends that we see happening in healthcare today is the whole trend to home hospitalization, which is really starting in the US, but we're seeing its adoption rising in other parts of the world, and it's getting supported by payers. So qualifying patients when they come to the emergency room, instead of getting admitted, will be hospitalized at home by using 24/7 telehealth, remote monitoring tools, and using that, we can save costs of around 30% that has been seen today. So these are some of the most exciting trends that we see happening in 2021, Deepa.
Great. So, what would you say has been the economic impact of COVID-19 on the healthcare industry?
That's a fabulous question. I think the whole COVID-19 impact has been huge. For example, we found that hospital elective procedures were completely put on hold for 6 months. And as a result of that, what has happened is that hospitals have lost almost $600 billion globally. So how will these hospitals really go back to business is the big question that is in the minds of many, many hospitals today. And that is why I believe more and more hospitals are investing in virtual care solutions. They're looking at other ways to generate money, because right now, even though elective procedures have started, I think it's going to take a lot of time to get to that point. I think the other big impact of COVID-19 had a huge impact on the medical device industry. The medical device industry suffered tremendously from the imaging perspective. People were not doing CTs and MRIs, and as a result, there was a decline of almost negative 4% that happened. The markets that have flourished tremendously has been diagnostics, medical diagnostics, and digital health. These are the two markets which are showing the highest growth rates of around 8% globally for the diagnostic industry, and digital health around 5% globally for 2021.
You mentioned digital health. How much of an impact is it having on improving patient outcomes today?
I think that's a really good question. I think digital health firstly gives patients access to healthcare. In remote areas when patients were not able to see doctors, and COVID-19 is enough testimonial for us to actually see that it happened. It gave us access to the healthcare system. So I think that's the first thing. It gives us access. We're looking at a high cell phone penetration that's happening in the world today. And I just think that whole penetration of cell phones will accelerate digital health. The second big thing that I think digital health has done is that it's helped to create more accuracy and more prediction to the healthcare system. If you look at artificial intelligence, the success of that has been huge in terms of being able to read lab tests, being able to read x-rays and CT scans, and reduce the workload and the burnout of the physician, which has happened tremendously as a result of COVID-19. So I think there's a lot of ways that we have to move forward with data. And I think creating a platform strategy that I talked about earlier is one of the ways that we could see the transition take place.
Great. So, along with the platform strategy, are there any other healthcare market segments that are likely to expand in the coming year?
Well, obviously, today everyone is focused on vaccines, and that's a huge, huge opportunity in a sense for the world. We're creating humanitarian impact in every single way possible at every nook and cranny of the world. But while the vaccine is going on, we're also building a therapeutic strategy that companies are investing on, and we're going to see a huge number of products, blockbusters come out as part of that therapeutic strategy. I think diagnostics has taken a huge leap as a result of COVID-19. We've seen tests happen in retail centers, in airports, in shopping malls as never before, and that has really escalated the whole invent of retail, what we call retail diagnostics. And eventually, we're going to see a lot of new businesses and a lot of growth opportunities come in to the fore, things that we had never thought about, and those will be more focused on reducing cost, whether it's administrative waste in hospitals, whether it's trying to identify the right doctor and match you with the right healthcare system or provider. All of these things are going to be digitized in the future, which will reduce cost dramatically. So we're going to get into a world which is very much going to be based on prediction, prevention, and personalization. So it's exciting times actually for us.
Amazing. Is there anything else you would like to add?
I just want to end by saying that, this is not a new normal now for us. This is the next normal, and we just have to get used to this because this is the way the healthcare industry is going to work and we will have to function. And I think companies need to start thinking ahead, and we need to start building tools, looking at virtualization and digitization. And I think these are the two most important things. And I think the third most important thing is we have to put the patient or the consumer at the center of the ecosystem. And COVID-19 have shown how important that is. And therefore, I do hope that we start building the tools and the software and the hardware and the platforms, and use the technology in the right way to benefit the customer and create a better customer experience than what we have done in the past with technology.
Amazing. Thank you so much for your time, Reenita.
Thank you.